Good morning, PT on ICE Daily Show. My name is Dr. Jess Gingerich, and I am here with the Pelvic Division on Pelvic Monday. I'm going to talk to you guys today about when you don't feel like you are a pelvic floor physical therapist, or you don't want to be, right? There's something to that. We want to make sure that we're respecting that. We have gotten into a place now where we have specialties, right? Not everybody, but specialties exist. Just because we specialize in one area, though, doesn't mean we're not screening other areas. If you're not specialized in pelvic floor, you should at least be screening it. I met with a provider in the OBGYN space this weekend, and she said something, and I thought it was really great. She said and she's in the prenatal space, so she's doing care for pregnant individuals. So she says when someone comes in and they're pregnant, that if they also tell her that they have ear pain, she's going to look in their ear. I'm trained to look in other places, is what she said. And I thought that was really great, especially going into today with what I was going to do on the podcast, because we have to be comfortable diving in to other areas. We are trained in those areas, or technically you're not trained necessarily in the pelvic floor, but you are trained in the musculoskeletal system, and you can understand clinical patterns and understand how the muscles are going to influence certain symptoms and or clinical patterns. So you need to listen to what they're telling you. So you need to have your body chart. You need to be writing your pain down on this body chart so you can see all of these clinical patterns. And then when you are treating someone and they have back pain up to the level of T8, hip pain, tailbone pain, SI joint pain, or anything that's radicular, or even some like pelvic surgeries or just a history of pelvic surgeries, you want to be screening this stuff. So have these questions down on your body chart, and you're going to screen. Are you leaking urine or anything from your bowels that you don't want to? Are you having any insertional pain? So this could be with intercourse. This could also be with a pelvic exam. Do you have even bouts of constipation? And then what's the frequency of that? And then are you having any pelvic pain? One of the other things that I love to screen, and I teach the people in my practice to screen, is menstrual cycle. Asking about the menstrual cycle. You are going to have people who menstruate that don't know if what normal is around their cycle, right? So they say, yeah, I bleed once a month. But what is that? Can you dive into that a little bit more? Are they bleeding every 21 to 35 days? That's technically normal. Or are they bleeding every 15 days, 1 month, and then every 35 days, another month? Get an understanding of that. It's just data. You don't have to then say, hey, you need to do this, but you can take that data and then send them to someone else who can help them. One of the biggest things that I want, and we say this in ICE all the time, if you are in the pelvic space, you have heard us say this, is positivity. So if you are relating someone's back pain and then they are saying, hey, I'm also leaking, and you say, did those two things come on maybe around the same time? And you are thinking that they're related, that can be a really scary thing for someone just because they don't know. And so always keep it light and airy and positive. If you don't know what to do, you can say, hey, let's dive into your back pain today. But we have Sally right next door who specializes in pelvic floor, and I can get you over there. You can even have just a brief phone conversation with her. Our L1 online class is perfect for the clinician that doesn't want to dive in and do the internal portion of pelvic floor, or really even go in only treating pelvic floor. So you will learn assessment strategies online, general interventions. You will get data so you can even tell people, hey, this is what the research is saying. And this will likely help your patients. You will likely get them feeling better, whether it's like you fully resolve their symptoms, or you give them some symptom relief, where then now they can go talk to Sally and really dive in to what they're doing. We offer on, if you head over to ptonice.com, we have clinicians that you can look into, especially ICE trained clinicians, and see where people are. If you don't have anyone in your area, that is still pretty common. We're still seeing that there's not pelvic floor PTs in certain areas. It's a little less common, but it still exists. We need to not sleep on virtual appointments. Virtual appointments are amazing. The other resource that we have, and all of these are free, is our free resources tab. And so this is going to actually have on here these screening tools that you can go in and add this to your eval list. It's a great resource. We recommend it all the time. So to recap, if you don't think you're a pelvic floor physical therapist, you are to a degree. You are to a degree where you're at least screening these symptoms. Diving into these symptoms, are there questions that you can follow up with? Be positive, always, only always. Treat what you can, and then refer what you don't. I'm doing a VICE later this month on February 18th. This is going to be on back to the basics. This is going to be for someone who is new to pelvic floor, who is the general clinician who is saying, hey, I'm seeing some of this stuff and I just kind of want to know where to start. I'm going to be giving trial treatments and just a nice place to just, hey, this is where we're going to start, because I maybe don't know. You're not going to tell your patient that, but general places to start that are going to be really great interventions. So I hope to see you there. Head over to ptonice.com to see where we'll be next. And we will look forward to seeing you.